I know that you all watch what's going on in the field of technology, and I guess most of you have started using ChatGPT. Well, let me tell you one thing. As the chairman of the Academy of Digital Health Sciences, we keep a track of what's going on, and at some places, we are driving that change too globally. What I see in my interaction with doctors is they are super excited about ChatGPT, and in that context, they are missing out on some of the development in their specialities. Yesterday, I was speaking at the National Health Summit in Bangalore, and a doctor walked up to me and asked about the courses we run and what do we teach. And I just asked him, "What's your specialty?" And he said that I'm an endocrinologist. And then he went on to add, like, what whatever may be teaching, I think I can use ChatGPT to do that. And I just asked him, "Do you know DTX?" He said, "What's that?" I said, "That's your problem. You believe ChatGPT can do everything for you as a doctor. You don't even know that two DTX have been approved by the government of India and the patient are using it, and you're still relying on ChatGPT." So while on one side there are exciting changes, but on the other side, do not overly rely on ChatGPT or AI. I think use your intelligence to get formally trained in digital health, because digital health is redefining clinical pathways on how you treat your patients. Let me share you one slide that will give you a sense of where the world is headed. Essentially, I'm a policymaker. I write policies. I've written the national health policy. I've written the national education policy, and now I created Viksit Bharat, which is a flagship program of the government. And as a policymaker, I look at how the world has changed, not just over the past few decades, but few centuries, in fact, millennia. So when I looked at the history of how the world has changed, earlier the countries that were stronger in agriculture were world leaders. India commanded 27% of the world GDP, being an agrarian economy. Then this shifted. If you were militarily strong, you ran the world. United Kingdom, United States, and then it became trade. So if you were strong in trade, you were strong. You ran the world. And this is how China shook the world. But now it's about technology. So one which is strong in technology is a leader. Whether it is you as an individual clinician, whether it's you as a CEO or a C-suite executive, whether it's a country, you have to be a leader in technology. So that's where everyone is jostling for this space. But it will be a big mistake for you to look this as a mere technology change or a business shift. What I call this, and this is my inference, that this is an intergenerational societal change. Society has changed. We are driven by technology. So everyone has to change with society. When the society changes, you cannot be away from it. So I strongly encourage you, to think about how you're going to implement technology in your organization, in your practice. Even if your friends are in other industries besides healthcare, please encourage them to adopt digital transformation, to get trained in digital technologies before the end of 2025, because that's the year that will define whether you will exist later or not. And technology is going to invade your roles and perhaps going to replace you as well. It's a harsh truth. Unless you convert the race between man and machine into a ride, and that can only happen when you master technologies. This is exactly we do through the Academy of Digital Health Sciences for Healthcare. We run a full 1 year online course delivered globally in digital health, and we run a 6 month course for founders and CEOs of hospitals, how to navigate this emerging paradigm. I think machines have started learning. Have you? Think about it. We are getting faster into an age where technology will decide your future, and you will not decide the future of technology. I have worked to create over 100 leaders who are global leaders today, conducting master classes in digital health. And I think it's people like you who should drive the future of healthcare.